Increased lactate levels are associated with hypoxia and metabolic acidosis secondary to anaerobic metabolism. Respiratory acidosis is caused by CO2 retention and impaired pulmonary function. Metabolic acidosis is related to bicarb therapy, diuretic vomiting, and nasogastric suctioning. Respiratory acidosis is caused by CO2 retention and impaired pulmonary function, which is inconsistent with lactate levels. Diuretics, non-potassium sparing, evidenced by finding of bicarb of 34 milliequivalents per liter, cause metabolic alkalosis. So it pulls out the potassium from the bloodstream, causing the potassium to move from the cells into the bloodstream to try to correct that imbalance, and then the bicarb increases to try to combat that. The nurse is caring for his client. So, with an oxygen saturation of 88% and accessory muscle use, the nurse provides oxygen and anticipates which of the following care orders. So, airway is the first A in ABC. Intubation, mechanical ventilation. Sodium bicarb is used to treat metabolic acidosis. This client displays hypoxemia. The nurse is caring for a client with acidosis. The nurse recognized that Kussmaul respirations are consistent with what situation? So Kussmaul's respiration, increased CO2 you're retaining, and then you're going to increase the rate and depth of breathing to blow off that CO2. No. Metabolic acidosis is caused by alcoholic beverages, methyl alcohol, and acetylsalicylic acid, aspirin. Mechanical ventilation is used to correct hypoxemia and hypercapnia, elevated PaCO2. Hydrochlorothiazide causes metabolic alkalosis.
Do you want to come with us, James, to go get Auntie Ash?
Okay. Maintaining blood glucose.
Yeah. Hold on. Go potty.
With a partial pressure of 62, the client has hypoxemia. A pH of 7.36 is normal. A peripheral pressure of CO2 at 35 is low normal, reflecting hyperventilation secondary to hypoxemia. And a bicarb of 26 is normal. So this is one of them I got wrong. Which client is most likely to exhibit the following ABG's results? So 7.30, that's low, right? So that's acidotic. Peripheral partial pressure of CO2 is partial pressure of CO2 is 49, so it's high. So respiratory acidosis right off the bat. Bicarb is normal, and the partial pressure of oxygen is 76, which is low. And I put client with hyperkalemia, but that would have to do with metabolic, I guess. Hyperkalemia can be caused by acidosis. It's not a cause of acidosis. Hydromorphone dilaudid, a narcotic analgesic, can cause respiratory depression, hypoventilation, and respiratory acidosis, as its blood gas reading demonstrates. So, which group is highest risk for respiratory acidosis? An athlete training, pregnant woman with hyperemesis gravidarum, person with uncontrolled diabetes, client who smokes cigarettes. Cigarette smoking worsens gas exchange, leading to disorders that contribute to hypoventilation and respiratory acidosis. A morbidly obese client has chosen gastric bypass surgery to promote weight loss. The nurse plans to teach the client about the need to perform monitoring to detect what disturbance with rapid weight loss. And it's ketosis. Starvation fasting or following a strict calorie-reduced diet with rapid weight loss contributes to ketone formation and metabolic acidosis. So, ketosis.
You don't eat cheese on for not getting out. We just pick her up.
Which acid-base balance does the nurse anticipate the client with morbid obesity?
I
So it's
got my
respiratory acidosis,
kids.
and my reasoning for picking that answer was increased weight on the chest caused from being morbidly obese decreases the expansion of the chest, causing hypoventilation and CO2 retention, causing respiratory acidosis. And let's see what they put for rationale. So their rationale is respiratory acidosis is related to CO2 retention, secondary to respiratory depression, inadequate chest expansion, airway obstruction, and reduced alveolar capillary diffusion, which are common in morbidly obese clients who experience inadequate chest expansion owing to the size and work of breathing. When caring for a client with a pulse ox of 89%, which actions does the nurse take first? So ABC, airway. No, there's no option for airway. B, breathing. And so yes, you would apply oxygen as prescribed, because oxygen is a medication and it must be prescribed. Applying oxygen is the first priority for a client with hypoxemia. It is unclear whether the client is stable to be out of bed, more appropriate to improve respiratory expansion. Okay. I actually did a lot better on this practice test than I thought I would. I got a 93.75%. And that is good.